Hello, and welcome to Everybody's Business. I'm Valerie Hellerman, and today I have Drenda Neiman, who is the Lewis and Clark County Health Officer. Thank you for coming, Drenda.
Absolutely, thanks for the invitation.
I have to say, I am so impressed with the work the department has done during this pandemic. It must be amazingly hard, and you probably haven't slept in a year now.
It feels as though neither I nor my team have. But I have to give credit to the people that work within our county health department. Very incredible professionals, experts in the field that have passion for this county and the residents of this county. They are just dedicated and are powering through. We are tired and hope that this will be done soon.
Yeah. So. Well, we were just talking off camera about how your job, it was all theoretical, the global pandemic, and now here you are in the midst of it.
Yeah, those public health professionals, you know, we read about it in the textbooks, right? All of this possibility, and we even prepare for, in some way, prepare for public health emergencies, but not to the level of a global pandemic. And so having that that lesson pop right out of a textbook and having to live through it's been quite a experience.
Oh, well, you guys did a wonderful job. So I want to talk about the vaccines that are around right now. And let's start first. We're going to show on the screen several times during this interview where you can get the information. You can go online, you can call the health department, and there's also a Facebook page, so please note that. Can you explain the designations and the schedule of those designations?
Yeah, the phasing that is put forth, first of all, the reasoning that we have phasing is because we don't have the vaccine, we don't have the availability of mass vaccination all at once. So therefore, we have to make determinations of who gets vaccine first, and then as we get more and more of the vaccine supply available to us, then who would be the next population. That's actually a very difficult conversation to have. There were a couple of different approaches that we saw happen. The first approach was the state plan presented by previous Governor Bullock, who decided that his approach was going to be more of a preservation of societal functioning. So we saw in phases, well, 1A was all healthcare providers, but then once we got past the 1A, 1B would have been like school personnel, educators, and frontline workers for grocery stores and things like that. So in other words, that was an approach that helped to preserve our society, get economy back rocking and rolling again. And then Governor Gianforte, when he took office, he made a change to the state vaccine plan, distribution plan, and his approach is more of a morbidity, mortality approach, which is not a wrong approach, it's just a different approach. So his plan really focuses in on what the epidemiology says about the impact the virus is having on people. So those that are most vulnerable will be getting the vaccine first. So phase 1B now is first and foremost those ages 70 and older. So that is the first tier of 1B. And then we'll move from there into 16 to 69 with some high-risk conditions. COPD, for example, is one of those high-risk conditions. It's a short list. The list is on our website. I encourage folks to go out and look at that list of high-risk conditions. And then individuals who are American Indian or those of color are also known to have a greater impact from the virus. And so those individuals, the list of elevated risk factors, it's actually quite longer. And so again, that list is on our website, and we encourage folks to look at the details of that. But asthma, for example, falls into that elevated risk. And so that's the 1B. And we have in our county 13,000 eligible people.
Under 1B?
Under 1B.
That's a lot.
Yes, yeah. And then we move into 1C, which then is, we go down to the next level. So anybody over the age of 16 to 65 with those elevated risk factors. So then we start kind of small and then work our way out until we can get the majority of our population in our county vaccinated.
And would people need a doctor's note proving that they have these conditions?
We are not asking for documentation.
Okay.
We are asking for registration because we only have so many vaccines available per vaccine clinic. And so next week when we start our 1B clinics, we're asking people to register, and we only have about 400 per day for the 2 days next week. So just short of 1,000 vaccinations we'll be giving next week.
Okay. And when do you expect the 1C people to be getting vaccinated?
If all is right in the world and things go smoothly with 1B administration and we get the vaccines just from the federal government down to the local level, so that the availability of the vaccine will drive the timeline mostly. We're anticipating March, first part of April is when we'll start doing 1C. But again, that is completely dependent on if we can get the vaccine.
Yeah.
So.
And why is there difficulty getting the vaccine? Is it not manufactured, or is it distribution issues?
Yeah, I'm not sure that I know the exact detail of what's happening. I do know that we only have 2 vaccines that are approved by the FDA. And so we have 2 pharmaceutical companies that are working really hard right now to serve the entire world.
Yeah.
And so I think that their production is going as fast as they can. And really at the local level, we have to have the staff available to administer the vaccine. And so there's only certain people that can do that work. And we are reliant on a pretty small pool of staff who can actually administer a vaccine. So that slows things down a bit too. But I have to say, Lewis and Clark County is if not number 1, close to the top as far as how fast we're able to administer once we have the vaccine available.
Well, I have to say from my own experience, as I am a frontline healthcare worker in my day job, and it was extremely efficient. It was at the Lewis and Clark Fairgrounds, which the whole drive-in area is so ideal for this. It was amazing. I got there at 6:30 in the morning. I was gone by 7:30. And it was quite easy, and I was feeling good.
Yes, excellent. And that's what I hope we will hear mostly from as far as feedback on the drive-through experience, is that it's efficient and we incredibly professional staff, very kind and friendly, and and organized to the point of being able to get in and out of there fairly quickly.
And also, after you had the vaccine, you had to stay 15 minutes in your car, and there were people walking up and down saying, put your flashers on and honk your horn if you don't feel well.
Right.
And there was an EMS ambulance there in case, so that was all reassuring.
Yeah, the observation period is very important because side effects are possible. And it's a 15-minute at least observation period. If there's some underlying health conditions or a medical history that dictates that observation period could be up to 30 minutes. But we are very, very careful to keep an eye on folks after they've gotten their vaccination in case that there are any side effects at all, that they have easy and quick access to medical assistance.
Well, that was reassuring to me.
Yes.
Okay, so let's talk about the efficacy of these vaccines. I know you're using Moderna and Pfizer companies. Are they the same? I mean, similar?
They're pretty similar. So what I can say is that, first of all, the FDA has the world's gold standard process as far as taking the research that's been done by the pharmaceutical companies and ensuring that these are safe vaccines and then also effective vaccines. And so what we're seeing for both Pfizer and Moderna, that they're way over 90% effective with the 2-dose regimen. So both doses are important. We want to make sure we send the message that just getting the 1 dose is enough. That isn't. That is that's a falsity, I guess. We want folks to understand how important it is to get that second dose. And then they're getting, up to 95% protection from that vaccine.
Oh, that's good.
It is.
Yeah. Now, what are the side effects?
So the federal government's watching this carefully, and they're collecting the data as the vaccine is being administered. And what we're seeing is minor side effects. And so a sore arm. My arm was sore for about 4 days, and it was more sore than I experienced with the flu shot. So really tender in the muscle. And then pretty fatigued is what I experienced, and that's pretty typical as well. To have maybe a little elevated fever and just a slight, just some fatigue. That's all really typical as far as the side effects are concerned. Not very often are we seeing anything more severe than that.
Now, if you've had COVID and take the vaccine, what happens?
Sure. Well, the vaccine is not live virus. And so if an individual has had COVID, diagnosed and experienced COVID, there was some short protection that occurred with those live antibodies. We're hearing up to 120 days worth of protection with the live virus, with the disease itself. And then with the vaccine, we, of course, more to come. It'll be under study as the vaccines roll out across the country and as time lapses. But their preliminary studies are showing up to a year for protection with the vaccine. So even if you've had the virus, we've had a virus in the disease, we absolutely recommend the vaccination.
Oh, that's interesting. So up to a year, that's quite a while.
It is, yeah. And that's preliminary. I think there's more to come as the vaccine is distributed and time goes by, we'll know more as far as how long it lasts.
And what about the variants? Because I know that, COVID in many ways is similar. It's not the flu, but it's similar. And there are variants every year with the flu. So how is that addressed?
Yeah, and I think the scientists knew that we needed to expect variants to happen with a virus. That's just what virus does, is it changes over the course of time. And so we are starting to see variants happen. What we understand right now, again, more to come as the researchers learn more about the variants, that they spread more quickly, but the vaccine, what they're seeing, at least preliminarily, is that the vaccine is protecting against the variant as well, at least the first variant that they saw, the one that came out of UK. So I understand there's another variant that's coming out of Brazil. And I think we should expect to see more.
Yeah.
And so we just need those scientists to keep up and push out information to us as quickly as they can so that we understand what that means for us as far as wearing our masks and keeping our distance, and what it means as far as protection with the vaccine.
Might it mean also having to have a yearly COVID shot?
It absolutely very well may mean that. We've been saying that from the beginning, that this could mean that when we get our flu shot, that we also get the COVID shot, because it may very well change from year to year. And those variants will have to be tracked and understood, and the vaccine adapted. But the flu shot is live virus.
Yeah.
And the COVID vaccine is not. It's a messenger RNA, which tells your body to start to build antibodies against the disease itself. So it works differently. And so, again, more to come. When the research catches up and the scientists publish more and more about the variants and about the vaccine and what this will mean for us long term, then we'll be able to share more. But we're learning as we go.
Yeah. So now, if you have had COVID or you have had the vaccine, that does not mean that you can take off your mask or go out and hug your family or friends or go out to dinner, right?
Yeah, right. The vaccine is step one. We need about 70% of our residents in our county to be considered the herd immunity that we're looking for, and a level of protection that then will allow us to move away from these public health precautionary measures that we've been using all along. So until we reach a point of about 70% vaccinated, we need to continue to use the masks, keep the distance, wash our hands, and sanitize surfaces. And another thing to note is that the vaccine itself protects you from getting the disease from the virus. It doesn't protect against you giving the virus to somebody else.
Because you could be a carrier.
You could be a carrier still. So yeah, because you have to think about the virus. You get the virus and the virus causes a disease. The vaccine prevents you from getting the disease. So it doesn't necessarily mean that it's going to prevent you from sharing that virus with your neighbor or your family member.
And maybe for the public, you could explain herd immunity.
Sure. So herd immunity is a public health term, but it's definitely one that's being used out there wide and far. And all that means is that we have enough protection in a community that we can all feel protected. So if only 1 or 2 people are protected with a vaccine, everyone else is still at high risk. But if we get to 70 or more % of our population that's protected, then we can say that everybody is pretty protected. And so we use the same theory or philosophy when it comes to the measles. Measles, mumps, and rubella. Not all kids are, you have to be at a certain age, for example, and not all kiddos are able to get that vaccine. But if the majority of our population is protected with a vaccine, we are also protecting those that can't get that vaccine. So that's what we mean by herd immunity, is that if the majority of us are protected, then we're all protected.
But what about the 30%? Are they at risk of getting the disease, but the majority of the community is not?
Yes, yeah, they're still at risk, but the risk of transmission goes way down. There's not as many people out there moving that virus around. So.
Yeah. But it's been such an amazing thing how this virus has struck globally. I mean, it just floors me.
Yeah, it's a small world after all.
Yeah, yeah. And what about tracking people with the virus? I know that that's a really difficult thing to test people, and are the tests accurate, and then how do you track people?
Sure, yeah, the testing that we've been doing is what we call a PCR. It's a diagnostic. It's for those that have gone through the experience, it's the swab that goes down deep in the nasal. It feels like a brain tickler.
Yeah.
It goes that far up in the nasal cavity. So that is a diagnostic PCR. They're very reliable, but they're not 100%. And so we have seen we've seen some false negatives and we've seen some false positives, but for the most part, they're pretty reliable and pretty accurate. If we have a question when a test comes back, so in other words, if somebody has classic COVID symptoms and that test comes back negative, we might recommend a second test just to make sure that that wasn't a mistake. But that's not happening very often. Most of the time, they're pretty accurate, and we do trust and rely on those test results to come back.
And then how do you track people?
So we have contact tracers that we get notification in public health of the result of the test, and then we have staff that will call and do a full investigation with the person who tested positive. So we get lots of information from that person about what they may have been doing in the last couple weeks, which tells us where exposure may have happened. And then we also get an understanding of who they may have been in contact with in the previous 48 hours before their symptoms started. That tells us who their close contacts may have been. We can then isolate the person who's been tested positive, so remove them from the general population and keep everyone else safe from ongoing spread, and then quarantine their close contacts for the 14 days and wait to see if they also get the disease. So 14 days is that incubation period. So if we quarantine them, wait and see for that 14 days, and they either have symptoms, and then we move them, get them tested, move them over to the list of cases, or they make it through their quarantine period of 14 days and they can go about their business. But
So after testing positive and quarantining, if you're asymptomatic, do you not need to be retested to see if you're negative?
not necessarily. So there have been cases where individuals are testing positive, no symptoms. Actually, the CDC put out a report, and I'm trying to remember I'm gonna do a guesstimate of about 30% of tests for asymptomatic folks were coming back positive. So about 30% were asymptomatic, no symptoms at all, and they were coming back positive.
And why did they get tested? Because why would you get tested unless you were symptomatic?
And a lot of them were close contacts.
Oh, okay, yeah.
Yeah. So asymptomatic, still tested positive. So at that point, the way their isolation works is the day they tested positive is the first day of their isolation, and they go 10 days. And 10 days is the typical amount of time that they're contagious.
Okay.
So as long as they meet that 10-day mark and they don't have any symptoms, then they can go about their day.
But
about
if you
their business.
still have symptoms after 10 days, are you considered contagious?
It may be,
Yeah.
yeah. That's a point at which our public health nurses step in and really assess the situation. And the thing about COVID is that some symptoms have been lingering. So we are seeing people that just have like a lingering cough for months,
Yeah.
or lingering, other lingering issues,
smell?
and taste.
Yeah.
And they're no longer contagious.
Okay.
So that's when our public health nurse kind of steps in and assesses the situation to see if it's clear to let them out of isolation and go about their business and not expose others in the community. But if there's severe symptoms beyond that 10 days, we'll keep them on that isolation until they've cleared their symptoms for the most part.
And speaking of severe symptoms, do we have a lot of people in Montana that are experiencing that? And how are our hospitals able to respond?
Yeah. Unfortunately, we still are seeing that quite a few folks that fall into that severe category. The report from the hospital just this morning actually indicated that they have over 20 patients in the hospital with COVID.
Here in Lewis and Clark?
Yep, at St. Peter's Hospital. So that's quite a bit. Their ICU capacity, again, is only 8 beds.
Yeah, and they're filled now?
And they are really close. ICU is really close to being full, and of course, they have COVID patients that are just on the medical floor and not in ICU, but sick enough to be in the hospital.
Yeah.
So, and we've, unfortunately, we've experienced more than 40 deaths right here in our county. We're way over 1,000 deaths in the state from COVID right now, which is more deaths than we've had for any car accidents or any other causes of death. COVID has now overreached that number of deaths in this past year.
Yeah, and if we just would keep social distancing.
Yeah, it's really simple. But what we know about the virus is that it cannot spread if people aren't together. So the mask is still a highly effective tool, and so is keeping your distance.
So now, I don't want to get into anything political, but our legislative session is running around Helena. Restaurants are open, they're having meetings, and they're not wearing masks, and already I think 1 or 2 legislators have tested positive. What does that mean to our community?
Yeah, we knew that the legislative session would impact Helena in particular. We have individuals that are coming and going from our community, back and forth between their home counties and here throughout the session. And yes, they are continuing to do their business as if we don't have a virus floating around. And so we're seeing legislators without masks on, and we're seeing legislators that are attending large group gatherings, which we know is those are environments in which the virus can easily spread. So we anticipated this. We have a dedicated contact tracer in place. We have protocols in place to work with the state because it's a multi-jurisdictional issue when we have a legislator from another county that tests positive, and it's a very complicated investigation to identify close contacts. So we have a dedicated team to react to the situation, because we advocated for the prevention measures to be put in place, keeping the distance, wearing the masks, going virtually. We advocated for all of those prevention measures, and they chose to hold session in their own way, which means that we have to react to the virus as it happens.
So I have a question. It always seemed to me that public health should be the final say to the government, because it's our health.
Sure.
Is that not the case?
Well, ideally, yes, that's how it's supposed to work, is if it's a public health issue, that public health takes the lead on the incident command, and public health takes the lead on what needs to happen to stop the spread of a deadly virus, for example. And in the case of COVID, from the federal level on down, it was politicized early on, which means that the politics, in some cases, really outweighed the public health advice. So we in public health just continue to say what we think is the right thing. And that's, that we know how viruses spread. We know that people are getting severely ill. We know that we're losing our neighbors and our friends and they're dying of complications from COVID. And so we just continue to say what we know is true, and let the public know how to protect themselves and their families. And that's to wear the mask and keep the distance and not gather. And we just hope that this is over soon, that with the vaccine, I think we're getting closer. So.
Oh, and I just have one final question about sort of the preparedness for this, because it seemed really complex. I mean, right from the beginning, it seemed like nobody in any of the states were prepared. It's like suddenly the apocalypse hit us and everyone was scrambling. Yep. How do we be prepared for something like this in the future? Because it kind of feels like this maybe is just the first of many that will come.
Yeah, well, this is a 100-year global pandemic. So the last was the Spanish influenza. And you would think that we would have learned from that, but what happens is 100 years go by, and priorities change, and resources are shifted, and that's what happened with public health in particular. Is the better job we do, the more resources are moved away from our work, and they get shifted to other priorities because we're doing a good job. Tobacco prevention is a really great example of. We at one point had a lot of money to do tobacco prevention work, and the more we were able to prevent the use of tobacco and those rates came down, that money started to shift away from public health, and we're starting to see the rates of tobacco go back up again.
Interesting.
So public health is really good about emergency preparedness. It wasn't long before the pandemic hit that we were doing a tabletop exercise on a hepatitis A outbreak. So we practice and we have plans in place. We update our plans on a regular basis. But you're right, nobody expected a global pandemic. So there were so many complications that came because of just the extent and the extent of the pandemic itself. That the fact that everybody in the world needed personal protective equipment. So that complicated it to the point where everything was strained and nobody could get what they needed. But in our country, if we just look at the United States, we need to do a better job of creating systems that allow things to happen more quickly. So what we saw early on, and I'll use personal protective equipment as an example, everybody needed it, but there was no clear and clean federal system that allowed that to happen. So what ended up happening is that each state was one to themselves. They had to beg and plead and borrow and steal to get what they needed in their state, which means that they were competing with other states instead of collaboratively working together and following a federal plan. So that is a lesson learned through this pandemic that we need to do better next time. Is we may not have the ability to have a warehouse full of PPE available at the drop of a hat, but we need a better system in place to get what we need quickly and get it delivered to who needs it the most in a timely manner.
Yeah.
And that's usually driven by a federal plan. So we at the local level end up being at the bottom of that food chain. We can't procure enough at the local level, but at the national level, they can procure for everyone and then let it filter down, and that's not what happened.
But I think you also mentioned before that some of these PPEs come from, or they come from international sources. So again, you're competing not only with the states, but with the whole world at this point.
That's absolutely true. And so there's another opportunity for our politicians, really, to look at the sources that we use to get the the PPE that we need, for example, and make sure that we have that available to us within our own country, and not rely so heavily, because of the fact that we can't rely on one country to supply the entire world when it comes to a pandemic. It just doesn't work out in anybody's favor. So we in the United States need to figure out a way to make sure that we have a supply available.
Well, Brenda, this has been very enlightening, and I again want to just compliment you and the health department on what a really great job you've done managing this whole crisis. And I just want to end with letting people know how to get in touch with the health department, especially if you are not computer savvy. Do they just call the health department to find out about when they're eligible for a vaccine or to make an appointment?
Yeah, and we have a really amazing hub up on our website right now. It's our COVID hub. It has all vaccine information. It has all of our case information. And so that is going to be the absolutely best way to get the most up-to-date information, is to go to our website and look at the COVID hub. However, we are getting information out. Social media is another way that we're getting a lot of information out. We have a Twitter feed now, which is new as of the pandemic. And then, of course, the typical media channels, the newspaper and the radio and the TV stations are all helping us get information out. And
HCTV.
HCTV, absolutely. And then our phone number is the 457-8900. When it comes to registering for the clinics just next week, we have great partners with RMDC. So their Agency on Aging will have a bank of folks that are answering the phone to help with individuals that need to get registered but don't have access to a computer or online ability to register at the website. So we're coming up with ways to make sure that accessibility is not a barrier for folks to get registered for their vaccine.
And I imagine the RMDC will be particularly helping seniors, to get in touch and get transportation and whatnot.
Absolutely. We're coming up with plans for mobile clinics. We're coming up with plans to get folks that aren't able to just drive out to the fairgrounds to the drive-through clinic, get them the assistance they need to get out there. So we know that this is a population that we need to really make sure we're covering all their bases, so that we're not leaving anybody out, and we're making sure everybody has access, that the vaccine is accessible to everyone when it's their turn.
Yeah, that's the thing. People are anxiously waiting.
Yes.
Well, again, Brenda, thank you so much for taking time out of your day to come here and inform us about all this great information. And again, please extend our thanks to the Lewis and Clark Health Department. They're doing a great job.
Thank you.
Thank you so much.
Thanks, and be well.
Thank you. Thanks from Everybody's Business.